We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
Because the news never stops.
Or at our Twitter account at 1480 WHBC. We'll also post at WHBC.com.
What's next? Keep listening to find out. News Talk 1480 WHBC.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Mercy Medical Center, and of course our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Dr. Brandon Blood with Apex Physical Medicine. Good morning, Dr. Blood, and welcome to the show.
Good morning, guys. I appreciate you having me back.
All right, Apex Physical Medicine is a unique practice, one that integrates the best of non-surgical medical care, chiropractic care, physical rehabilitation, soft tissue therapy, and nutrition therapy. Apex offers non-surgical treatment options and programs to help patients suffering from acute and chronic pain conditions. Their goal is not only to reduce pain, but to restore the quality of life and help prevent recurrence. We'd like to remind our listeners today that you can find our program on your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime, and we'd appreciate it if you please subscribe.
So, Dr. Blood, it's been a while since you've been on the show. Okay, we're really happy to have you back. So take a moment to introduce yourself to the listeners.
Absolutely. Thanks for having me back again. I appreciate it. My name is Dr. Blood, and we have Apex Physical Medicine located in Canton, Ohio. We're an integrated medical center that provides focus for treatment of conditions for chronic pain, acute pain issues. And we're excited to be able to offer this to our community. And I also just wanted to take a second and thank you guys. You've been able to help procure some good supplies for us when none of our suppliers have been able to help. So I appreciate you guys over the last several months being able to get some things for us when we need it. So
we're always there, and we're now loaded with that stuff, and it's cheap.
Yeah, right. Well, I hopefully it goes away soon, but I know some of these things for a little while to come. So
for sure. So how long have you been practicing, and where is your practice located?
So I've been practicing since 2007, so approaching my 14th anniversary here. Our practice is on Dressler Road. We are next to the La Pizzeria restaurant and banquet facility. That's kind of the staple on the corner there. So pretty conveniently located in the area.
So what's your approach to care?
So at Apex, what we look at is we believe that from an acute pain as well as a chronic pain standpoint, we look at how the body functions, and we look at pain as your check engine light, meaning something's not right. So we have to figure out what's not right, and then look at the functional deficits, and then at that point we can restore. So the unique thing with us is we kind of have different licenses, different skill sets, and ultimately we try to work together from different backgrounds, educational backgrounds, and experience to look at all different avenues that we can ultimately help our patients reduce their pain, restore their quality of life, and get people back to doing the activities that they want to do.
You know, Doctor, chiropractic care seems to be more recognized by an increasing amount of medical doctors, along with combined services and referrals. What led to this? From my opinion and my experience, I would say that there's been a little bit of a void in the treatment of especially chronic pain. So a lot of different, whether it's from a medical perspective, an insurance perspective, is figuring out how different things can come, different therapy options, treatment options can come into play to assist in patients overcoming. So like family medicine,
they have a lot of other health conditions they like to, or they need to, I should say, monitor and manage. And sometimes chronic pain is because of there's so many variables with it that I think there's a lot more collaboration to say, okay, this is what I can do. Maybe this is what this place can do for you. And so from a chiropractic perspective, we've been able to try to step into a role of assisting in the management of various pain conditions.
So it seems that chiropractic care uses adjustments and manipulation on every patient. Is that accurate?
So that's definitely a staple in our profession. That being said, it's not the end all be all, and at least in our office, because what we look at is we want whatever's best for the patient, and sometimes depending on the condition or the amount of pain someone's in, we have to figure out other avenues to be able to facilitate the recovery. So there's also an element that patients are very apprehensive. Maybe they watched a YouTube video, or a family member had an unfortunate, not a good experience. So they're starting to become, those types of individuals might become more open to it, but they might have a strong apprehension to certain things. And the last thing we want to do is force something onto somebody that's not, what they're ready for, what they want. But ultimately it may not be what they need, at least at some points in the care plan. So we try to offer different things to overcome, ultimately keeping the end goal in mind of what the patient is looking for. And then what tool set do we have? And that's one of the tools that we can use in our clinic, but it's not the only tool.
So how safe and affordable is chiropractic care?
From a safety standpoint, it's very safe. Largely, if you even just look at, from a malpractice standpoint, right, our malpractice insurance is very reasonable relative to some of our medical colleagues. So not that automatically means safety. It just, I think from a risk standpoint, it's the risks associated with the type of services we provide are often very low. We like to provide service that have a low risk and potentially a very high benefit. And that's what we always look at. So from a safety standpoint, services are pretty safe. From a affordable standpoint, most insurances tend to cover what we do. Healthcare in general is getting a little bit more costly these days for various reasons, but our job is to try to make it as affordable as possible to help people so they have other options available to them.
Cool. So how about some garden variety conditions that you commonly see?
I would say that the mainstays of what we typically see is neck pain and associated conditions, like headaches, tension-type headaches, even some migraine conditions. So neck pain and headaches is a big one. Of course, lower back pain, because that's very prevalent in our society. And then conditions associated with that, like sciatica or degenerative disc issues. We'll see various injury type things. If someone's been in an automobile accident and they have injuries as a result of that, or a work-related injury. But those I would say neck pain, headaches, back pain would be the mainstay of what we typically see. That being said, we have a really cool joint program, especially for knee pain, tennis elbow, plantar fasciitis. So we see a variety of neuromusculoskeletal conditions that involve something with the musculoskeletal system.
What about peripheral neuropathy?
Yeah, that's an interesting one. I'm glad you brought that one up. Peripheral neuropathy is we've been treating that maybe 5-6 years now, and peripheral neuropathy is one of those conditions that medically there's kind of limited options for. So, in a lot of our patients, I like to accept a challenge on a patient, right? So there's certain conditions that people come in with. They don't necessarily come in seeking for that particular condition, but they might say, hey, I also have peripheral neuropathy. Is there anything you guys do for it? So over the years, we've looked and researched and say there's got to be a way. So we've been able to evolve our program, but to try to find successful treatment options for the management of symptoms of the pain, numbness, tingling of peripheral neuropathy. So our neuropathy program is pretty popular, and it's a nice alternative or a plan for people that have the condition and are out of options and are looking for things that might be able to help them, whether it's sleep better. Balance is a big issue with peripheral neuropathy, and there's that fall risk, so we want to try to mitigate that as much as possible. But we have a very unique approach to peripheral neuropathy.
So from the pharmacy side, we might look at some different medications to help deal with the nerve pain, or maybe deal with circulation, maybe even some nutrition to deal with some antioxidants to help. Well, what's your approach at your practice? How are you different because I'm guessing for the most part, it's a non-drug solution.
Well, of course, but, at the same time, patients might say, hey, I've taken the gabapentins, or I found like alpha-lipoic acid or acetyl L-carnitine B vitamins that are commonly from either pharmaceutical or a nutraceutical type benefit. So a lot of patients are still on that, and they've gotten to a point, and it's like, I'm here, but I want to be here. So what we look at is we have an electromedical device that helps from an FDA clearance standpoint. It helps with inflammatory properties that can go on with peripheral neuropathy, as well as a circulation component. Most neuropathies, from our perspective, are there's not a healthy blood flow to supply the nerve so the nerve can function. So we look at things to help improve circulation. And then we take some of those vitamins, the alpha-lipoic acids, the acetyl L-carnitine, trace minerals, various things, and we're actually this is where it's unique, where we have medical providers, because they take those and they're actually able to inject it into the tissue, and then the cell signaling device, the electromedical device, helps essentially push it in for the most part, but provide nutrients so the body can function, increase circulation so we can get blood flow to the area to help nerve tissue heal. So it's not necessarily a replacement plan for, say, a gabapentin. A lot of times it's in conjunction with or in addition to that. Or if someone didn't have a good experience with the medication, maybe they had a side effect that wasn't pleasant for them. And they're like, I tried it, gave me some relief, but I had to deal with something else as a result of it. What else is available? So it's either an add-on or it just depends on the patient scenario.
So what type of patient would be a candidate for that procedure? Does the patient need a referral from their provider to you, or can they call and get more information about that? How does that work?
Absolutely. I mean, so I always look at it. It's always good to collaborate with, especially the primary care doc that might be managing that. So if the patient comes directly to us, which they can, most of the time a referral isn't necessary. But we try to have good communication in the sense of either if the patient does come to us, we want to try to work with the primary care doc or whoever's managing that condition. They don't necessarily need that referral, but we either get it. Sometimes there's other variables where we need to get clearance for other health issues. That we'll see the patient and say, hey, this is going on. Let's try to reach out to your family doc, make sure that what we're looking to do is not going to impede anything else that might be going on in the system. So, but no referrals necessary. But we like to try to communicate and be a part of the healthcare plan of the patient.
Okay, doctor, we're going to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
Yes, we are open. We are open. The Medicine Center Pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play: our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Brandon Blood from Apex Physical Medicine.
Dr. Blood, is there anything that your practice can do for patients with spinal stenosis?
So spinal stenosis, yes, that's another challenging condition that we saw a lot of. That again, looking for options available for individuals that have it, because it's another one of those medical conditions that can be very challenging for various providers to try to manage and deal with, and ultimately help the patient function. So what we look at is obviously what the extent of it, and we want to make sure that from a neurological standpoint, there's not neurocompromise to a point where a patient does need more of a orthopedic type opinion for it. But if we've got that and we've dealt with that, and patients are looking for that, we look at how do we influence, how do we open the spinal canal as much as possible? Again, how do we get blood flow and circulation so tissues can heal and function? So we've incorporated a variety of different methods to help patients try to decrease pain. We can't necessarily take a aged spine and make it young again, but we can do our best to increase as much function as possible.
Can you explain stenosis, spinal stenosis?
So spinal stenosis is often characterized by three factors. So stenosis itself means the canal that the spinal cord comes down our spine with, the hole should be this big, but because of a few variables, it's now this big. So the canal is closed in, and it's usually a result of three things. One is some type of disc issue, like a bulging disc or disc osteophyte complex where there's a bone there. And then on the other side of that is there's a ligament that runs down the back of our spine called the anterior longitudinal ligament. And that sometimes hypertrophies, means it gets bigger, so then that pushes in this side. And then the joints of the back, the facet joints, they when they degenerate, they often get bigger, which kind of makes it's kind of that counterintuitive. Like, I thought it was degenerating. Why is it getting bigger? But our body tends to lay down more tissue or bone, osteophyte bone spurs, in areas of extra stress. It's kind of like a callus on the foot. Rather than keep getting blisters, the body says, I'm going to toughen that skin up. So the set joints on the back side of it, they often get bigger because of extra stress to that area. So the body wants to toughen it up, but that closes down the spinal canal.
So how common is it?
I would say it's quite common in patients as maybe they get into their 60s or 70s. Not everybody ends up with it, but the way our spine tends to deteriorate is common in a lot of us, just because of movement pattern issues and things that are common in our society. So it's a pretty common condition that we have to deal with and try to manage and help people function so they can stay active, so they can do things that they want to do in terms of whether it's going to a grandchild's baseball game, basketball game, or visiting, whatever the case may be. So,
is there a general part of the spine that it's most common in, or can it be anywhere in the spine?
I would say the lower back, the lumbar spine would probably be the most common, but it can also happen in the cervical spine as well. But I would say the lumbar spinal stenosis would be the more of the condition for the lower back. And it's often one of the main symptoms of it would be a person can only walk for, say, 3 to 5 minutes. Their legs start either burning or numb or tingling, and they have to sit down and they have to lean forward because flexion opens up the spinal canal, and then that helps get the information that the legs need to function, and they can stand up and walk again. So claudication effects are a common symptom of spinal stenosis too.
So why do we get this?
So from my opinion, so we look at a long time ago, there was a medical physiatrist, Dr. Yanda. And Dr. Yanda said he kind of identified and broke down movement pattern issues that most of us fall into. So for instance, we sit a lot, as well as a society, unless we're young and playing sports, we don't do a lot of lateral movement. So if we sit a lot and our body's in a certain position for extended periods of time, what Dr. Yanda kind of identified was our hamstring muscles get tight on the leg. From the spine to the hip, there's a muscle we call the hip flexor, or the psoas. That gets shortened. Then there's another muscle group called the glute medius that's involved that shuts off because we don't use it. And then the paraspinals get very tight and active. So over time, when these things are in place, our spine, the mechanics of our spine may change. And then when that happens, our body has to adapt. So that's where discs may be deteriorating because they're not moving like they want to, so we're not getting good blood flow to the disc. Those facet joints have extra stress because the way gravity's affecting that component and because our spinal mechanics have changed. So that's where functional patterns over time, we're really good in our society to say, if I don't have a symptom, I don't have a problem, right? But a lot of times symptoms can be the last things that come on and some of the first things that go away. So when we don't address things, even in the absence of symptoms, our spine will break down over time. That's why it's a lot of times associated with age. Like, I'm just getting older. Well, these things are a process of time. Age is a process of time, so they kind of go more hand in hand. But not every 75-year-old has spinal stenosis. So it's not. There's just a lot of variables. Work life. What did I do for a living? Just was I involved in a lot of contact sports? Was I involved in multiple car accident trauma type things? So there's a lot of variables that go into why someone may develop it. But a lot of times we just look at how the body functions or stops functioning over a period of time.
Okay, I talked you into the news, Doctor. It's time for the news break. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy on News Talk 1480 WHBC.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, I'm Pam Cook.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station, News Talk 1480 WHBC.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Hey, welcome back to Health Matters with the Medicine Center Pharmacy. This morning we're talking with Dr. Brandon Blood from Apex Physical Medicine.
Okay, so before the break, you were talking about all things spine and making me feel like I need to get up and do some stretches and exercise and stuff like that. So,
right.
Yeah, you know, in the pharmacy, we do see a lot of patients suffering from back pain, and it might probably be worth it for you to touch on degenerative disc disease or other disc conditions that you see at your practice and how you can help patients affect change.
Absolutely. In this kind of similar scenarios with the spinal stenosis, but the discs in our spine, they're kind of like cushions or shock absorbers, but the vertebrae complex, that's a joint, right? And so when we don't have good mobility through a joint, we're not going to have good circulation, because joint pressure or disc pressure, but joint pressure is a pressurized system, right? And then blood pressure, right? Our cardiovascular system is a pressurized system. And it's not likely that our joint system and our blood pressure system are always going to have the same pressures at the same time. So the body the way we were designed is we don't have good circulation to the discs, because we don't want to bleed into the joint, nor do we want to get joint fluid into the bloodstream. So in order for the disc to get blood flow and circulation, we have to move. And we have a lot of joints in our spine, so things aren't going to move the way they want to if we're not perfectly balanced, or our posture is not good. If we have, it's so hard in our daily life to be perfectly balanced. So if we don't get good movement through our spine, things tend to get tight. We restrict blood flow because we're not moving, and the imbibition, the fluid flow into the disc and back out isn't happening. So they deteriorate over time. So what we look at from a clinical standpoint is how can we actually influence blood flow and circulation to get the nutrients to the area, improve function and mobility, because a lot of times when people have a disc issue, they're also going to have a joint issue because it's multifactorial. We're really good at looking at an MRI and saying, this is your issue, when in actuality there's a combined issue going on. So we like to say, okay, this is your primary issue. Here's your secondary issues. This is how we get the results that we achieve. So degenerative disc, we like to increase blood flow. We like to address the muscle tension that's often around that area, increase joint function. And that's where, again, the check engine, like the pain signal, typically decides and that's the physical component of pain. You guys are really good at helping patients with the chemical component of issues, whether it's, tight muscles that maybe a short-term muscle relaxer can be beneficial for, or other anti-inflammatories or things. So that's where collaboration is key, that we don't tell patients, say, you don't need to take that, we just need to do this. Sometimes we need to do our part, medicine can do their part, and then together that's what helps get the patient, the goals where we're looking to get to.
One more question about stenosis. You talked about standing or sitting a lot, and sitting a lot might bring on stenosis. What about people like pharmacists who stand most of their life? Mm-hmm. Are they possibly prone to stenosis?
A lot of it goes back to mechanics. Again, the body wants to move, and if we're sedentary in one stance or one sitting position, then that's when things can start not moving the way we want, and the body tries to adapt and it won't. But yeah, a lot of even in my profession, I have to watch my mechanics. I'm over patients all day. I'm sitting dictating reports often, so I'm not immune to these particular things either. So every profession, even a pharmacist that's doing a lot of standing, they're counting, or you obviously know better, but the head's down a lot. So our mechanics, how our upper back and neck get involved. And so the big thing is if we do that 8, 10, 12 hours a day, however long that shift is, and we don't do things to counteract that, over time, the body's going to try to adapt, but then it eventually won't, and that's when our check engine light pops on.
So at what point is it necessary for you to refer a patient to another medical specialty?
Mm-hmm. Great question. So, again, it varies on that. So if we are the first point of contact for a health condition and we find what we consider red flags, there's something that, like a progressive neurological deficit, meaning, motor strength is an issue, or we have other things that we don't feel we are the first point of contact for, then we say, okay, something's not adding up. We have to be smart enough to say this. We need to communicate this with a specialist or a family doc. So that's if we're the first point of contact. Then what may happen is of course we want to be logical in our approach to care. We don't want to treat people for periods of time and not figure out we've got them where they want to be. So then what that is, if we're not reaching certain benchmarks, or the patients, they're continuing to regress, and that's when we say timeout. Maybe we need to get another opinion or diagnostic image, and then co-manage, or hey, we did what we could. Now we need to get to the appropriate specialist to help us further along. So depends on the patient condition, depends on where they're at in the spectrum of care. If we're the first point versus we're just not responding or something's not adding up, we need to get another good mind on this. Let's get another opinion. I love, I'm not one to say, I know everything. So if something's not right, then we need to get another mind on it.
What about diagnosis? Are you using X-rays or MRIs or on every patient?
So we often do not. If it's indicated, so X-ray is the indication most of the time is trauma, or if someone has other red flags that indicate, hey, we need to look at this. We need to make sure joints, bones, everything's intact. if that's all appears good, X-rays for us initially often don't change the way we look at things or how we want to address or treat. We want to work on those functional deficits. Same with MRIs. MRIs can be a little more specific depending on what we're looking for. If we're not responding, if we didn't need X-rays because they weren't indicated initially and they're not responding, that's when we start looking at, okay, we need a picture. We need to see what this looks like. And then that will then help determine, do we either need to change course of action of what we're doing, or do we need to pause what we're doing and say, okay, this according to this image, we need either to go to this type of specialist or that type of specialist. So they kind of help dictate care, but oftentimes early on the plan, they're not going to change how we approach things unless there's an indication for that image that we need.
Sure. How about insurance coverage? Where I know workman's comp covers chiropractic care, but I don't know about normal regular health insurance.
Yeah, most commercial policies, though, they're really good at covering chiropractic care, and of course, per deductibles and copays and coinsurances. Medicare, Medicaid, we have coverage for that as well. So most health insurances that exist will have. For our clinic, whether it's chiropractic, medical services, we tend to fall into, and we like to review that with the patient. Patients want to know three things: what's wrong, what's it going to take to fix me, and how much is it going to cost. So we want to address all those three variables in terms of addressing the what it takes to fix. What their insurance is going to help, how that's going to help facilitate them along. So. We like to identify that early on in the plan.
Okay, so what about foods? Okay, how do foods in your diet create pain? And the secondary question is, what foods should we avoid?
Great question. So I've done a lot of nutritional research, and it really boils down to what we call fatty acids. So supplementally, and you guys probably have a lot in your pharmacies, is omega-3 fish oil, and that is a polyunsaturated fatty acid. So omega-3, the advertising, it's good for the heart, it's good for the brain, it's good for joints, and a lot of it's because it has somewhat of a natural anti-inflammatory response. So we hear a lot about omega-3s. The omega-6 side of it is we don't hear much about, and that's what's pro-inflammatory. That means that it can create somewhat of a chronic, we call it subclinical, meaning we don't notice it like perceptionally, but a chronic subclinical experience of inflammation that over time, unchecked, that's where it can make painful conditions like a fibromyalgia, at least part of that process because of the inflammation in our system. So we look at from either a supplement and or a food standpoint as what's high in omega-3 fatty acids, what's low in omega-6 fatty acids, and how we balance that out. So foods like the ones we love, the grains, the flours, the sugars, those tend to have more omega-6 fatty acids. Even from a protein standpoint, cows that eat grain they're going to have that grain component in their makeup, in the meat makeup. So we need to, that's where we usually recommend like a grass-fed meat over a grain-fed meat because of the fatty acid component. We want to try to keep that in check as much as possible. So,
okay, between those two types of beef, okay?
Mm-hmm.
Is there a difference in taste if one is grass-fed or one is grain-fed?
So I started with grass-fed beef back around 2005. And back then, it was much harder to get. It wasn't a standard practice in the beef industry. So early on, it tended to be a little bit more chewy or gamier. But I think over time, they've kind of figured out, proper nutrition that helps keep it somewhat lean, but at the same time, still have good flavor, good consistency. So I would say what's available now is more tasty from that standpoint than it was when I started in the grass-fed beef, and I had to order it and get it shipped frozen in. Now you can go to Earth Fare, local stores that have it pretty readily available.
The reason I bring that up is because some friends of mine live on the West Coast, and every time they come here and have a steak or something, they say, gosh, your beef tastes so much better than ours because ours is all pellet. Our beef is all pellet fed or grain fed or something like that. We got to take a break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy on News Talk 1480 WHBC.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out by Store in Louisville, next to the Medicine Center Pharmacy.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off on Out by Store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
We are back. You're listening to Health Matters with the Medicine Center Pharmacy. Today we were talking with Dr. Blood.
You were getting ready to tell us about some inflammatory and anti-inflammatory foods. So how about you touch on some foods that might exacerbate pain or make it worse just because of their inflammatory properties? Is that a fair question?
I think that's a fair question. I think from an exacerbation standpoint, because from a chemistry perspective, and you guys are probably better at chemistry than I am, but from a chemistry perspective, is if our bodies predispose chemically, because foods are chemicals when you essentially break them down, right? Food's chemistry, medications chemistry. There's a lot of chemistry involved, but if we just try to break it down to say, okay, we know that sugar, flour, processed oils, things of that nature, our body's not really designed to know how to process and handle accordingly. It's going to put our chemistry of our cells, especially our phospholipid bilayer, which is around our cells, it's going to program them to be excited for inflammation. And there's a lot of inflammatory links to a lot of health conditions these days, not just pain, but from a pain perspective, a lot of patients that can make the commitment, it's a tough one, but if they can make the commitment to at the very least cut out sugar and flour and refined oils like vegetable oil or soybean oil or sunflower oil, they made oils sound like very healthy, like sunflower. Like sunflowers are pretty, flowers, right? So that should be healthy. And it's actually very inflammatory to our system. Our body doesn't know how to handle the high intake of omega-6 fatty acids that are contained in the sunflower oil or these other products. So sugar, flour, and oils would be a big one if from a pain standpoint. If we can dial that back, help change the chemistry of our cells, then the inflammatory response may mitigate and calm down a little bit.
So you're talking about the oils. One of the more popular ways of cooking currently is they call it an air fryer. Is that what they're called? I mean, we don't own one, but
I don't own one either. So I'm not sure, but I think there's better ways to cook foods. From an oil standpoint, we look at 3 primary oils: olive oil for cold preparation, so for salad dressings or things of that sort. Mm-hmm. Coconut oil is good for heat preparations, and then fish oil for supplementation. I also use butter fat, like from grass-fed cows. There's a line that the source of the fat's from a grass-fed cow versus a grain-fed cow. But those are the big fats. Fat's a good thing. A long time ago, we were told it was a bad thing, and they switched it to you should go non-fat. Our body, like our brains, are made of fat. Like we need fat to function in our body. So just have to have the right fat, the healthy fat.
All right.
What about some thing is too much of a good thing?
What about some go-to nutritional recommendations? During the pandemic, we've been recommending patients keep an eye on their vitamin D intakes and, maybe some zinc and vitamin C. But what are some staples that you see that your patients benefit from that they may be lacking in that they might not be aware?
Vitamin D is huge, especially with this. I mean, it's not necessarily to treat it per se, but it's more our body. There's a lot of studies coming out on vitamin D deficiency in response with the pandemic. But anyways, vitamin D is a good thing to consume. And the cool thing is you can get that lab test that says, okay, here's objective data. We're here. We should be here. And how do we supplement or prescription vitamin D to get that to the ideal? So outside of vitamin D, I love proteolytic enzymes and natural anti-inflammatories like ginger, bromelain, turmeric. Sometimes turmeric by itself, people, from a pain perspective, has good natural anti-inflammatory properties. Magnesium is another important one in terms of how it's involved in our metabolic system. Magnesium, though, is important, for your listeners that may be taking medication. Sometimes magnesium can inhibit the absorption of meds, so that's you want to take that at potentially a different time. Again, you guys know better than that, but magnesium is important in vitamin D. Multivitamin, just for baseline nutrition. Coenzyme Q10 is another one, especially for statin users. Coenzyme Q10 is a very, very good antioxidant. And then from there, we look at, okay, is there a specific condition? For ophthalmology patients, sometimes L-arginine is good because it's a vasodilator. It helps get circulation. So depends on the condition. Say, okay, here's our baseline nutrition that we need to supplement our diet with. And then here's what may help facilitate, I can't say treat, but help facilitate other conditions that our body may be experiencing.
What about things to be careful with? And I guess I asked that question in the vein of just because a little bit of something's good, it doesn't mean a lot of something's better.
Right. Absolutely. And that's where, again, there's times where patients might have several medications that they're on, and I'll say, hey, we need to consider this, but let's double check with the pharmacist, because there's good software out there that might say there's some drug nutrient interactions. But from a consumption standpoint, too much of a good thing can be too much of a good thing. So, it's from a nutrient level, it's hard to, because, a bag of chips, like a serving size of a bag of chips for most of us is the whole bag, right? So, so we often think, well, how much should I take of that when we don't really think about, well, how much should I not take or eat of that? But usually following the recommended dosing on the supplements is a good place to start. Some should be a little bit higher, like vitamin D should be a little bit higher, especially in Canton, Ohio.
We're running close on time, so I want to make sure you share with our listeners and viewers your contact info and how to get more information about what they've heard from you today and to make sure they can take advantage of your services.
Absolutely. Our telephone number, again, is Apex Physical Medicine, 330-479-9193. is our telephone number. Our web address is apexphysicalmedicine.com, and we're trying to get just a public information page up there for resources for stretching, just even if you're not a patient of ours, just to try to provide information that may help patients that need it. So that's a good resource on our website that we're trying to populate more info on. But Apex Physical Medicine, Canton, Ohio, 330-479-9193.
Hey, thanks a lot, Doctor. Dr. Brandon Blood, founder and clinic director of Apex Physical Medicine. The show is very interesting. We learned a lot. And we'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. And thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we see you right here again next Friday. Thank you very much.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists, Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.